So what we're doing, we've already done a consultation with the beautiful Sally and worked out a few things that we're going to do. So raise your eyebrows up, Sally. We're going to treat the forehead lines, but in a way that we actually create a little bit of a lift in the lateral part of the brow. Frown in there. We're going to get rid of this frown, and relax. That will actually lift that up and flatten that out. You won't be able to make that frown, but you will be able to raise your eyebrows. We're also going to, Sally's got a little bit of an overactive jaw or chin really, and that's just lifting up and flattening the chin there. So roll your bottom lip out for me. So we're going to put a little bit of Botox in there. And we've also got a little muscle here that's pulling the corners of the mouth down. Chin's going up and the corners are coming down. So this is very much something that we can prevent. It's not age related, it's just genetic. It's what you've been handed down, usually from your mum. And very much worthwhile treating and fixing that before it actually occurs, because Sally's got beautiful lips. The last thing we want to do is have them look like that, and that's what they'll look like over time. Now the other thing that we noticed looking at Sally's face is that her jawline is very, very strong. She's got a very, very strong cheek muscle here, the masseter muscle, and this is involved in jaw clenching. So when we see it quite prominent like this, it usually indicates that this person clenches their jaw or grinds their teeth at night. And Sally, do you grind your teeth at night?
Yes, I do.
And do you get pain in your jaw?
I do.
Yeah, okay. So it usually goes hand in hand. So when we treat this, it's really a win-win situation. We treat it because we can actually slim that jawline right down and make it a much more glamorous, feminine shape of a face, but it also stops that jaw grinding, which is really, really important. So clench for me. So some dentists, where they get people to have soft diet, Valium, and wearing a mouth guard, which to me, I mean, I had that problem too, and it was really unsatisfactory having it treated that way. But putting a little bit of Botox into here, it's just fantastic. It just relieves that pain enormously. And the good thing about that is that treatment usually lasts about 8 to 9 months too. But overall, what we're going to do is a little bit of Botox here, a little bit of Botox down here, and also in the jaw. And then what we're going to see over time is we're going to actually get this much softer jawline here with no pain. And then what we might do, if Sally's feeling like doing so in a little bit of time, maybe a month or so down the track, is putting a little bit of filler here and just redefining that cheekbone and just giving a little bit more curve and structure to that cheekbone, which will really look just beautiful. Now Sally also has headaches fairly regularly, and they're quite typical of a migraine in that she feels them in the temples and also in the back of the neck. So we're actually going to also put a little bit of Botox just into the 2 little points here and a little bit into the temples, and in addition to treating that frown or the forehead and that frown there, that should give her complete relief of headaches for about 3 to 4 months.
Sounds good.
Okay, we'll draw it all up. That's right. Stop that now. Okay, so we're just doing the forehead now, so just little tiny injections here. And these are just very, very superficial. We don't want these to be very deep at all, so there'll never be a bruise. There should never be a bruise with Botox. And putting it in superficially, it does sting a little bit, but it only stings for the moment that you're doing the injection. And these little bumps that we create, they'll disappear within a couple of minutes. So that's the forehead done. Now we're going to do the frown. So you're frowning a little here. This is usually the stingiest area that we treat. In these areas, really, if you're going to a good injector, it should be, the risk factors should be almost non-existent. And that should frown done. So that's that one we just did then, Sally. That's usually the most uncomfortable of anything that we do.
Really?
That's not bad, is it?
No.
Head back. And this is to stop your chin from pulling up. So this is very much preventative. And this is the corner of the mouth pulling down with this naughty little muscle here. A little bit to me. That's it. And oh gosh, what am I doing? Okay, that's good. Then we're going to do very strong masseter muscle. Yeah, you can sort of feel it, can't you, in that muscle, because it's usually that muscle's being tender from clenching. So the effect of the jaw clenching will be better within a week, but the slimming of the jawline will occur for about a month. So we get you back in a month's time, check that the clenching has completely ceased and that you don't have any other spots that are still sore. If you do, we treat those. And if we want to create more slimming down of the jawline, we put a little bit more Botox in there as well. So with the masseter, if it's any interest, we treat it in a star pattern because the masseter muscle is actually 3 layers and you've got to treat all of them, otherwise you'll have a funny bulking action when you clench your jaw. Okay, so that's so we've treated the forehead lines, but we've done it in a way that this will lift up. We've treated the frown in the middle there. We've treated the chin from pulling up, we've treated the mouth from pulling down, and now what we're going to do is hit the key points that are specific to Sally's migraine. So Sally, what I want you to do is tell me where you're sore now. People can be different.
There.
In there?
Yeah. Yeah, that one.
That one
Yeah.
further back. So we're coming into the temporal notch there. Is it back further there?
Yeah. Yeah.
There.
Yeah.
And then I'm going to get you to sit forward and throw your legs over the side, and we'll do the 2 at the back. Okay. You tell me when you hit that sweet spot there. There. And migraine, for the majority of people we see, it's just a given that it's a really, really effective treatment. And you're all done.
Okay.
Okay, pain relief, out of 10, be honest.
Pain. I think these ones actually probably the most, but it wasn't as bearable.
Out of 10, if 10 was the worst pain ever and 0 was no pain at all.
4, 5,
Yeah.
the most.
Okay. And now, have you got any discomfort at all?
No, can't feel anything.
Good. And Sally will be going straight back out to reception, so it shows you that it really is a lunchtime procedure and that you can have it done and there's nothing to be seen. And we haven't even touched up your makeup yet, so that's it. That's how easy it is.